But this is all happening while junior doctors are carrying out yet another load of strikes, starting with 7 o'clock in the morning tomorrow through to the 23rd, the day before Christmas Eve. And that's just before the second lot come in the new year. Health chiefs are warning this latest round of industrial action will cause major disruption within the NHS. What's left of it, of course. Meanwhile, MPs are bracing themselves for, and get this, a £6,000 pay rise, apparently in line with inflation. Joining me now is the former NHS Trust Chair, Martin Gower. Welcome to the newly improved Independent Republic, Martin. Good to see you tonight in the evenings. You and I haven't spoken for a while, but we've basically got a 2-week strike starting tomorrow, haven't we? As far as I'm concerned, taking it up to Christmas Eve for the first 3 days, then going all the way through to sort of Boxing Day. Then you suddenly get into just before New Year, and then suddenly there's another strike on the 3rd of January for a week. So I would say that the NHS is pretty much going to be out of commission for the next 2 weeks, isn't it?
Yes, it looks very good for some of them for their skiing holidays and spending more time with their family over Christmas.
Verbier is going to be busy as hell.
And the NHS is going to be as busy as hell in many places, not everywhere, but in many places. I mean, Mike, first thing first, I do feel for the people who will be impacted by this, people who are ill and sick and need care and are not going to get it. Yeah. I really feel for them, and I see the strike as a strike against them. It's done as much to hurt the patient as anything else. And, you know, the BMA should hang their heads in shame. This is a disgraceful strike. It's a very poor action. We know why they're doing it. It's to further try and undermine the government. I mean, that's what it's really all about. It's a sad and bad time for the medical profession. And as far as the NHS is concerned, I mean, I've been doing a lot of study work on the NHS. I'm giving some talks and presentations around the place in the next few months. And you know, I think the chances of it surviving in any like its present form is zero. I think that's for the birds. I really do.
Well, exactly right. As we were just hearing from our dental representative there, you know, there isn't the capacity in the dental business in the NHS to work out how many people can actually be seen. And you can't see enough people if you're an NHS dentist. It's going to be the same for the NHS in general, isn't it? People are just going to stop going to GPs. They're going to get private GPs. They're going to get private health insurance. And health insurance is going to become a thing that more and more people have.
Well, it is. And I think there's two things there, Mike, really. One is that no other country runs an NHS like we do. There's never been exported effectively. People don't want an NHS or anything like it. And, you know, the biggest single difference is that nobody, even the people Sean was talking about, dentistry, that's not being funded from general taxation. It really isn't. France, Germany, they don't fund from general taxation. Now, they both have compulsory insurance schemes, which are part funded by the private and public sectors. And many of them wouldn't include, for example, dentistry. Yeah. And the other thing is, I think the NHS, it's like so many of the public services. I was listening to your program for the last half hour since it started. And there's a lot of places where we know things aren't working. And I think the biggest cause of that is that they're just not focused on the real job they need to do. If you get some minutes, or you can listen in to an NHS board meeting, you'll find they talk about all sorts of stuff, but kind of don't spend a lot of time worrying and committing themselves to what they need to do to their core business.
No.
And we've seen all the equality and diversity stuff. I mean, I don't think that's costing the NHS a massive amount of money. I think it's about 800 champions of equality and diversity. But actually, it is a diversion for the people who lead it. It's something that shouldn't be a priority right now. There's plenty of laws to protect people who feel that they've been in any way treated poorly because of their race or their sex or anything. So we need the NHS, for what it's worth, to concentrate on the job. But really, the idea of funding your health service from general taxation simply doesn't and never will work. Nobody else is doing it. Australia does it a bit, maybe 50-50. But if you take the case in Germany, if you have over a certain salary, I think it's something like 70,000 euros a year, you have the choice of opting out completely out of the state system, or the state contribution, the
Yeah.
insurance contribution, and going privately. We have no choice about anything. And
No.
the dentistry thing, I have an NHS dentist. They're very, very good. They're very helpful. But actually, will that last forever? I don't know.
Well, it won't, because I was told by my NHS dentist, basically I should go private when I wanted something particular
Yeah.
done, and that was what I ended up having to do. But talking of diversity, Professor Carol Sikora tweeted this out earlier today. I spent over 40 years in the NHS, many of those as Director of Cancer Services at Hammersmith Hospital. We treated all with care and respect, regardless of skin colour or background. Staff were hired on merit, patients were treated equally, and it was all done without a single diversity officer in sight. And that, I think, tells you all you need to know. But listen, thank you very much indeed. We'll be talking again, I'm sure, to Martin Gower over the course of the next week or so, because this is where the NHS is doing itself such terrible damage, because we know that almost 1 million appointments have been lost as a result of all of these strikes that have been going on for the last year, more or less. And cancer appointments in particular have been done away with to the tune of something like 50,000. And there will be more cancer appointments. So if you're involved in that, if you've got an appointment being cancelled, do let us know. 0344 499 1000.